month. So, so happy 16th birthday to me. My job title is the Metropolitan Public Affairs Specialist. I've been in this role for about 6 years now. Prior to that, I was a claims representative, and I, distributed information and took claims for retirement, for SSI, for disability. I did a brief stint after that as a supervisor. And then after that, I got into public affairs and communications. So disseminating the information about what the agency does on a day-to-day basis is kind of my spiel. That's what I do. I love to do it. But I will read this. I'm going to start the presentation off with this kind of a formal script. So for more than 80 years, Social Security has helped secure today and tomorrow by providing benefits and financial protection for millions of people throughout their life's journey. Social Security touches the lives of every American, both directly and indirectly. As you consider the information that you are about to receive, I encourage you to think about all the ways Social Security has been linked to your life and the lives of your loved ones. So we can start the slideshow. I don't see it yet. I don't know if it's up. Perfect, great. My apologies. Did I go? Can you guys hear me? My phone just rang and I'm on my phone. Okay, perfect. If we can go back to the previous slide, the agenda. And there's a spot where you can actually put it in presentation mode. There's a little, it's a slideshow mode. I can't see it on your screen, but you can actually put it in slideshow mode so it could occupy the whole screen. Perfect. All right, so today's agenda, what we're going to be talking about is Social Security disability versus SSI. And we're going to discuss some of the eligibility factors when we're talking about disability. We'll also talk about our online portal of services, which is known as My Social Security. We'll end it by discussing a brief informational session as it pertains to Medicare. And then we'll open the floor up for questions and answers. Feel free to put some of your questions into the chat. And at the end of the presentation, we will do our best to address those. Next slide. So did you know that about 178 million workers pay into Social Security, and about 94% of all those workers are covered by Social Security? This information comes from our 2021 Trustees Report. Next slide. So this image illustrates the number of beneficiaries that we pay. Currently, more than 1 in every 6 people in America is receiving Social Security. The majority of our beneficiaries are retired. But Social Security is more than just retirement. It's a family protection plan. Social Security is an intergenerational transfer system, which simply means that today's workers help pay for current retirees and other beneficiaries' benefits, not their own future benefits. So that's one of the misconceptions when we're thinking about Social Security. Some people believe or have been led to believe that there's this pot of gold with their name on it and they're putting money into that, but it's just for them. But no, it's an intergenerational transfer system where today's workers help pay for current beneficiaries. And like I said, again, there's no account set aside with your name on it. Next slide. So these are just some of the disability statistics. Social Security disability payments, they're modest. As of October 21st, Social Security paid an average monthly disability benefit of $1,154.05. That is barely enough to keep a beneficiary above the poverty guidelines. And the poverty guidelines as of January 2021 is about $12,888 annually. According to the United States Census Bureau, about 85.2 million people living in the United States, which is 27% of the population, they live with a disability. Of those, 55.1 million, about 18% of the population, live with a severe disability. Next slide. So with regards to talking about disability programs, Social Security administers two different programs. The first of which is SSDI, which is known and is an acronym for Social Security Disability Insurance. So Social Security disability definition requires you to have a medical condition that prevents you from doing substantial work for at least 12 months, or your condition is terminal. This work determination is based on your age, your education, and your work experience. So our definition makes a clear distinction between Social Security disability requirements compared to other disability programs, such as that of the VA and workers' comp. In addition to meeting the definition of disability, you must have worked long enough for the SSDI program, and it has to have been recent enough for you to qualify. The number of work credits you need to qualify for disability depends on your age when you became disabled. Generally speaking, you need 40 credits or 40 quarters of coverage. 20 of those quarters or those credits have to be earned within the last 10 years, ending with the year you became disabled. Now, obviously for younger people, it's a little different because they require less work and fewer credits. But generally speaking, you need that you have those 40 quarters of coverage, and 20 quarters of those, or 20 credits of those, they have to be earned within the 10 years prior to your disability, or prior to your work ending due to your disability. The application, as far as applying for Social Security disability, that can be done in person. And right now it's a little tricky because our offices are closed to the public. They're closed to the public, but we are doing some dire need situations. If an individual doesn't have any access to telephone or online services, we can deem that dire need and have them come into our office. But to keep things safe, we're doing most of our appointments via telephone, some submissions by mail, but one of the easier ways to do or to file for disability is to do that online. The application, after you submit that, whether it's in person, by telephone, or online, is sent to what we call Disability Determination Services, and they evaluate a person's disability or their disabling condition. After a person becomes eligible for a disability benefit, the law requires us to conduct a medical review to ensure that the beneficiary still qualifies for the program. This generally occurs every 3 to 7 years, depending on the severity of the disability. Next slide. Okay, so moving forward to the other program that we administer that focuses in on disability, that's called Supplemental Security Income, SSI. So SSI is a federal income supplement program funded by general tax revenues. It's not Social Security taxes. Social Security administers the SSI program, which pays monthly benefits to adults with limited income and resources who are disabled, who may be blind, or are also 65 years of age or older. Blind or disabled children may also get SSI as well. So people who have worked long enough and recent enough, they may be able to receive Social Security disability benefits as well as SSI. So normally when we're filing a claim for disability, we file for Social Security disability and for the SSI program, because you may be able to get a combination of the two. But if your benefit as a disabled individual is too high, if it exceeds what our federal benefit rate is, which is, I believe now is $841, you're not going to be eligible for the SSI program. Again, it's a needs-based program. So income or other types of sources of income, anything, it could allow for that benefit to fluctuate. But if you're making too much on one program, Social Security disability, you're not going to be eligible for the SSI program. Next slide. So when you file an application for disability benefits with Social Security, we always check on your eligibility for both of our programs. The same medical requirements apply to both the programs, but the non-medical requirements, they differ. Staff at your local Social Security field office review your non-medical eligibility. If you meet all the non-medical requirements for SSDI, SSI, or both programs, we send your claim or claims to a medical examiner who works for the state, and that's the Disability Determination Services, or DDS. Once the medical examiner makes a medical decision on your application, you receive a notification by mail, and your local Social Security office, they receive the notification electronically. If your claim is approved, you start receiving your monthly disability benefits. If it happens to be denied, you do have 60 days to appeal. So for Social Security Disability Insurance, or SSDI, you must have recent work history in order for you to receive the benefits. Adults must have worked and earned Social Security credits in 5 out of the last 10 years prior to the onset of their disability. So some of the, like I said, some of the non-medical requirements, they differ a little bit. But as I said before, with regards to the disabling condition, that's the same. You have to have, your condition has to be one of which where it's going to keep you from earning anything substantial for at least 12 months, or it's terminal. So these are just some of the differences between SSDI versus SSI. And again, if it's kind of, I'm moving too fast because it's so much information, you can always visit our website, which is on the slide, socialsecurity.gov, for different, for more information. Next slide. So disability evaluation under Social Security. So we have a book that's called the Blue Book. It provides, specifically prepared to provide physicians and other health professionals with an understanding of the disability programs administered by Social Security. It explains how each program works and the kinds of information a health professional can furnish to help ensure sound and prompt determinations and decisions on disability claims. Sometimes what we often see is that when a person files for disability, we send out the information to their medical physician. Maybe their medical physician kind of takes a little bit too long, or they don't provide the correct information for our disability examiners, and it gets a little murky. That is a part of the reason why sometimes people get denied immediately. But it's important. So if you are just getting this information for a person, this Social Security Blue Book is gold, because it's something that you could provide to a physician. You say, hey, I'm filing for disability. I just need you to take a look at this Blue Book to make sure you're sending out the right information to Social Security so they can make a sound and quick decision. Next slide. So at Social Security, we have a special program called Compassionate Allowances, or CAL cases, which you can get a much faster, expedited medical decision if you're diagnosed with specific conditions. These conditions are selected using information received at public outreach hearings, comments received by Social Security and DDS communities, council of medical and specific experts, and our research with the National Institute of Health, or NIH. In fact, there's more than 225 conditions that qualify for expedited disability processing through this program. I would tell you to go to our website and type in compassionate allowances, to get a list of all of those 225 conditions. Next slide. There's a program known as Wounded Warriors Veterans. At Social Security, we realized that the effect of military service can be profound and lasting. There are a number of financial, social, and health issues that result from military service. Some wounded warriors, as well as veterans who have a compensation rate of 100%, are unaware that we have several programs that may expedite their processing of their disability claims. So if a person is 100% disabled through the VA, that is enough for them to immediately qualify for Social Security disability benefits. So they won't have to go through the rigorous determinations that we have to do with disability determination services. They would immediately qualify and start receiving benefits if they were eligible. Next slide. So if a person happens to disagree with their medical decision, I've explained before, if you are denied, you get 60 days. So you have that right to appeal within the 60 days of the date on your on the notice that you received as far as your denial decision. You can check the status of your claim online, or of your appeal rather, on that My Social Security account. And I'll talk about that a little later. Next slide. So a lot of questions we get from individuals who are disabled, and they want to know if they can work, what are some of the work incentives? So one of the Social Security Administration's highest priorities is to support efforts of disabled beneficiaries who want to work by developing policies and services to help them reach their employment goals. Our employment support provisions are intended to assist you in your efforts to become self-sufficient to work. Employment supports can help you find a job or start a business, protect your cash and medical benefits while you work, or save money or to go to school. If your benefits end because of your work and you have to stop working later, employment supports can make it easy to begin receiving benefits again. So a lot of the questions we get from individuals, can I work while I'm collecting a disability benefit? And yes, you can. Next slide. But it all depends on something that's called substantial gainful activity. So for this year, for 2022, a person could work up to, and this is a gross amount, they can work up to a collective benefit up to the amount of $1,350. If you start earning over that amount, then we would consider that to be, that's too much for you to actually be receiving Social Security disability. For persons who are blind, the amount of earnings for the SGA amount, they go up a little bit more, and that's $2,260 per month. So when a person first starts collecting Social Security disability, within the first 5 years, they're given what's called a trial work period. So during that trial work period, and it's not consecutive, it's a 9-month period during a 5-year time spans, where you can kind of practice working, or you can not have to worry about your benefits stopping or what have you, but that only occurs within the first 5 years. So again, the trial work period is a period of 9 months where it's designed for a person to get reacclimated with work. You're considered to have used one of those months when you earn $970. And again, you're only given those 9 months. They exist only within the first 5 years of a person collecting disability benefits. Another change for 2022, the federal benefit rate is now $841 per month. And that's that SSI program again. It's a needs-based program. So you can only get as much as $841 per month. And a couple, I believe, is $1,261 per month. Next slide. So the amount of earnings that will have no effect on eligibility or benefits for SSI beneficiaries who are students is $8,230 per year. So a person who is collecting disability, they're in college, they can still work, they can still do, because I know a lot of some college students, they do the work and school programs. They just have to make sure that those programs, or that it doesn't exceed that $8,230 per year. The amount of earnings that we can exclude each month, until we have excluded the maximum for the year, is $2,040 per month. So a student just has to be cognizant of that yearly amount. We've seen an increase in the monthly Medicare Part A, and I'll get into the Medicare momentarily. But if a person has less than the 40 quarters of coverage, they would be paying $499 for the Part A per month. I'll get into some more of the Medicare stuff, but I'll go to the next slide. So I discussed this before with regards to how to apply for benefits. Right now, because of the pandemic, the easiest way to file is online. But you can also give our office a phone call and schedule an appointment. The appointment will be more than likely done over the phone. And you know, the 1-800 number is simple, but we also, if you Google it, you can also find the direct office's number to schedule your appointment. So right now, the easiest way to apply for benefits is online. If you are disabled, you can file for retirement and disability with the same application. But you can also schedule your appointment by phone. In-office appointments are dire need cases only. Next slide. So I've discussed our website. Our website is easy to navigate and easy to find certain information. It's kind of like a big picture book, but it's really accessible from a computer, a tablet, or a smartphone. And that brings me to start discussing the next slide, which is talking about My Social Security. Now, I'm not sure if you guys have My Social Security account, but it is a convenient and secure suite of services designed to put you in control of your personal Social Security information, as well as help you manage your benefits when you're ready. Your account gives you the information you need whenever you want it, all without calling or visiting a field office.
This is a reminder. Drink water.
You can open up a My Social Security account for yourself. You can't open the account for another person, unfortunately. That's just how it goes. Our legalese have not figured out a way for other people to open accounts for other people, but we're just trying to avoid scams and frauds. But you may be unable to open up a My Social Security account if for some reason or another you have blocked internet or electronic access. Some people who have been subject to those breaches and their information has been leaked. Sometimes, you know, unbeknownst to ourselves, we get an email and we sign up for certain services to protect our identity, but that blocks us from having a certain My Social Security account. So that may pose difficulty for certain individuals in that case. Next slide. But as far as the My Social Security and the services, there's so much you can do. You can request a replacement Social Security card, get a benefit verification letter, check your benefits and your payment information. You can change your address, your phone number, you can start or change your direct deposit information. You can get a replacement Medicare card or a 1099 when it comes to tax season. Next slide. So Social Security continues to evaluate and improve how to protect what's important to you. So we take this responsibility seriously, and we have a robust cybersecurity program in place to help people or protect the personal information you entrust to us. Adding Social Security measures to safeguard your personal information, but making our services easy to use is a vital part of keeping you safe and secure. It's like a lot of things with regards to the two-tiered authentication. You know how before you enter maybe your favorite site to buy something, it will send you a code, and then you would be allowed to enter into the site. Social Security, My Social Security is similar to that. You know, you would go on, sign into your account, and then you would get a special code sent to your phone and or email and then you would type in that code and it would allow you to gain access to your My Social Security account. So we do take security very seriously. I think that we move to the next slide. Okay, let's see. So just a little bit more with regards to, are we on that next slide? I think it's the slide after that. So next slide, sorry. Okay, so how to open a My Social Security account is fairly easy. You can visit our website and there's a My Social Security button on there. You can sign in or create your account. Provide some personal information. And what we do is we do a soft inquiry on your credit. It doesn't affect your credit at all. And we use that to gain information so we can ask you relevant questions that pertain to you and only you. Some of the questions, some of the things or comments we've gotten about it is these questions are a little bit too in-depth. And I can't remember what car I bought back in 1985, but these are questions that are designed to keep you safe and keep the information for you, and it's only yours. So, but it's fairly easy. Visit our website, sign in, create the account, provide some personal information, choose your username and password, and you're good to go. Okay, so now I want to transition to Medicare. We should be aware of all the parts of Medicare. Medicare Part A is your hospital insurance, Part B is your medical insurance. Part C and D, they're not administered by Social Security. Part C is this Medicare Advantage plan that kind of gives you a plan that encompasses Part A, Part B, and Part D. But Social Security doesn't administer those programs. That's administered by private insurance companies, as well as Part D, which is prescription drug plans. So a little bit about the 4 parts. So Medicare Part A, again, is your hospital insurance, which covers most inpatient hospital expenses. The deductible for Part A, and it's been the same since 2019, is $1,364. Medicare Part B is your medical insurance, which covers about 80% of your doctor bills and other outpatient expenses after you pay the first $185 in approved charges. So the standard monthly premium now for Medicare Part B is $140, I believe. So if once you become eligible for the Medicare, whether through retirement or for disability, you're expected to pay the $140, or sorry, it's $170. That's deducted from your benefit, whether it be retirement or disability. So Medicare Part C, again, that's not a part that we administer, but Part C involves the Medicare Advantage plans, which are health plan options offered by Medicare approved private insurance companies. When you join a Medicare Advantage plan, you get the benefits and services covered under Part A, B, and Part D. And Medicare Part D is your Medicare prescription drug coverage. It covers a major portion of your prescription drug costs, your out-of-pocket costs, your monthly premiums, annual deductibles, and prescription co-payments. They'll vary by the plan. But again, they are not, Medicare Part D is not administered by Social Security. Next slide. So as it pertains to the Medicare eligibility, individuals who are at the age of 65, they can qualify for Medicare. But if you are collecting disability, for the most part, you have to have been collecting disability for 2 years before you become eligible for Medicare. You can become immediately eligible for Medicare, however, if you are suffering from kidney failure or if you have ALS. So those are the 2 conditions that an individual will get the Medicare eligibility immediately. You should apply for the Medicare 3 months before your 65th birthday, even when you plan to apply for retirement or your spouse's benefits later. So say, but if you're working currently, say you're working currently and you have coverage through your job, You don't necessarily have to file for any parts of Medicare. That's one of the biggest misconceptions. Because once you turn 65, we have people running at our doors saying, hey, I have to file for Medicare. Our first question is always, hey, are you covered through your employer? If you're covered through your employer, or maybe the employer of your spouse who is actively working, then you don't need to apply for Medicare at all. But Medicare Part A is automatically assigned to a retirement benefit. So if you are receiving retirement and you turn Medicare eligible age, Medicare Part A is automatically assigned. You'll receive some type of notification in the mail with regards to Part B 3 months prior to your 65th birth month. But talking about Medicare enrollment, the initial enrollment period has a 7-month enrollment period window. It begins 3 months prior or before your 65th birth month, includes the month you turn the age 65, and ends 3 months after that birthday. Now, special enrollment, the special enrollment period, and I kind of alluded to that in the previous slide. If you are 65 or older, you or your spouse are still working and covered under a group health plan based on your current employment, you may not need to apply for medical insurance or Medicare at the age of 65. So you can qualify as for a special enrollment period that will let you sign up for Medicare Part B at the time you retire. We'll ask you some questions. We'll send you a form that you'll have HR fill out to indicate that, hey, at the age of 65, I was covered all the way up to my retirement. And then we can start your Medicare as soon as you retire. Now, the general enrollment period, if you didn't sign up for Medicare Part A or B when you were first eligible and you aren't eligible for the special enrollment period, you can sign up during our general enrollment period, which is between January 1st and March 31st of every year. You may have to pay a late enrollment penalty, but that all depends. The rate for late filing for Medicare, it's 10%. It goes up 10% every year for late filing. So 10% of whatever the base premium. So you would have to, if it's 1 year, based on our current premium of $170, you're going to have to pay an additional $17 for that late filing. Next slide. So this chart shows you your Medicare and when it will become effective if you apply during your initial enrollment period. If you apply during the 3-month window prior to the month you turn the age 65, your Medicare kicks in the first day of the month you reach the age 65, and it's pretty much self-explanatory on the chart. Let's see here. Next slide. So Medicare Part B premiums, they are affected by a person's work. And, you know, in this chart, kind of the graphic, it just kind of displays a little bit as far as to what the additional amount you have to pay if you are earning over a certain amount. If you're making under $91,000 as an individual person, or making under $182,000 or less, then you're just going to pay the standard premium of $170. But when you start making more than that, then you'll see the adjustments going up by $68 if you're making over $176,000. You just start to see that every year it goes, with every tier rather, it goes up more and more. You're just adding more onto that. And it does affect your Medicare Part D premium as well. Although we don't administer the Part D program, if we're notified, we are notified when a person does have Medicare Part D, and we have a close correlation and a look at what they're earning, that will affect your Part D premium. You will see the increase come out of your retirement benefit. Let's see. So next slide. So as Social Security, you know, we just keep in mind that you apply for Medicare by contacting us, the Medicare Part A and Part B, but we, you know, Medicare is run actually by another government agency, which is referred to as the Centers for Medicare and Medicaid Services, or CMS. But they don't really have a physical office. So utilizing the Medicare.gov website is a good way to find out maybe about how much your out-of-pocket cost may be for a certain procedure, or maybe you're wondering about, hey, I don't know if this insurance is going to cover that. You'll go to the Medicare.gov website, and it's a plethora of information. Next slide. So again, you can use our website to apply for Medicare Part A and Part B. If you already have Medicare Part A and you wish to add Medicare Part B, we'll simply mail you forms. It's called the 40B. We'll mail you forms, and then you would just mail that back to Social Security, and we would apply for the Medicare Part B. So I know that was a ton of information to throw at you, and this just displays the new Medicare card. We used to have a Medicare card with your Social Security number on it, but now we don't do that. We have a unique number that's designed just specifically for you, and it helps you protect your identity. But yeah, that's it. So we're now approaching the Q&A segment. And I want to open the floor for questions. I don't know if there are any questions in the chat, but yeah, we're open now for the Q&A segment of the presentation. So let's see here. I'm just gonna go to the chat.